So let's continue the discussion here, looking at what happens to the system as we age and mature, starting with puberty and then looking at aging issues within the system. So when we talk about puberty, we're talking about having a non-chronological development here. So even though we associate ages with puberty, the actual age upon which puberty takes place is independent of the actual puberty itself. Puberty is a non chronological maturation process that's going to be dependent upon a whole bunch of factors. Some of them are going to be the concentration of the free sex hormones that we have within the plasma. Some of them are going to be based off of how much binding globulin is there to regulate the amount of free sex hormone that's there. Some of them can be related to adiposity issues and physical activity issues of the adolescent child. But we have to remember is that even though we're going to be associating ages with them, the way in which puberty takes place is going to be independent of actual age of the individual. So the first thing we're going to look at here is with the male reproductive maturation. So male reproductive maturation will begin around 13 years of age with the standard deviation of about plus or minus 2. And so if we look at this in terms of a normal population curve, we'll have the majority of the males entering puberty somewhere between 11 and 15 years of age. However, the standard normal for what would be normal reproductive maturation can begin as early as 9 and as late as 17 years of age. This range of start times will be partially genetic, but it'll also be dealing with environmental and nutritional factors that come into play as it relates to adipokine signals and endocrine disrupting signals that will impact the free testosterone levels for the male during this pubertal development within adolescence. It takes about 4 years for maturation to take place. There's not really a whole bunch of regulation indications that we have to worry about for the male, unlike with the female, which we'll take a look at here in a second, where they're going to exit about 4 years later. So if we enter at about 13 years of age, we'll be exiting around 17 years of age. But then we have a wider scale in terms of when puberty will end for the male. So it's about a 4 year window after the standard norm. So it can be anywhere from 17 as their standard norm. So 21 all the way down to 13. If you notice, it's going to be based off of when the person's going to enter puberty as to when they're going to exit puberty. However, with the changing levels of adiposity within males, the end point for puberty has been starting to extend slightly, and we'll get to this when we look at is puberty actually changing in terms of age demographics. When we look at the pupil development for males, it goes through what's referred to as the Tanner scales or the Tanner stages, in which we start with what's referred to as the pre-adolescent genitalia. The pre-adolescent genitalia is going to have a flaccid penis that is a few centimeters in length, with very little testicular volume, very little pubic hair. As we start to undergo the Tanner development, we will start getting sparse pubic hair that is going to be light in pigment. And we'll start seeing enlargement of the testicles with the change of the scrotum, where the scrotum will start to slightly discolor due to exposure to testosterone. We'll start seeing a change in the skin texture of the scrotum as well. As we move towards Tanner stage 3, what's happening is that the pubic hair becomes a little bit more coarse, and we'll start seeing a greater pigmentation within the pubic hair. We will start seeing a elongation of the penis in terms of both girth as well as in terms of circumference as well as length, where we're going to go from a couple of centimeters to a flaccid penis that is between 2 and 4 centimeters in length. We will continue to have development into Tanner stage 4. At Tanner stage 4, we start having where the genitalia starts to look adultish, where we're going to have elongation and engorgement of the glans region of the penis. We will start seeing continued darkening of the scrotal skin. We will also see darkening around the glans region of the penis. This is once again an indication of response to testosterone. The male at this point in time can start to have erections, both spontaneous as well as non-spontaneous erections. However, the ejaculation will not take place with any high level of sperm. As we get towards between Tanner stage 3, Tanner stage 4 and Tanner stage 5, the volume of the testicles will continue to increase. We will start having the elongation of the penis as well as increased girth in terms of circumference of the body of the penis to the point of adult representation. We will be able to have controlled and uncontrolled or spontaneous and non-spontaneous erections, as well as ejaculation for the male, in which the ejaculation will have the full matrix of ejaculatory matrix, including motile sperm. The female reproductive system will take slightly longer in terms of full maturation. Most of this change in maturation has to deal with the need for the hypothalamus to learn how to go about doing the cyclic regulation in terms of the positive feedback followed by the negative feedback within the regulation pathway. Some of this is going to lead to changes within what we would consider to be a normal menstrual cycle, where the cycle can be excessively short or excessively long within the pubertal time frame. In terms of age of onset, we usually see age of onset somewhere around 11 years of age with a standard deviation of about plus or minus 3. This plus or minus 3 in terms of a normal standard population gives us a range that looks something like this. This range means that it's not abnormal, regardless of what the news media might purport, to have young females entering puberty between 5 and 8 years of age, given that the standard norm is 11. Once puberty has started, it takes about a decade in order to go about doing the pubertal change. And once again, most of the pubertal change that we're seeing within the female in terms of this time frame and why it takes a little bit longer for the female than the male is because of the need to learn how to regulate the cyclic nature of the reproductive regulation pathways here. And so we'll see them exiting somewhere between 20 plus or minus 5 years of age. So if you look at it, we're looking at between 30 and 11 or 12 in terms of when they first enter. Once again, just like with the male, it's the endpoint is going to be based off of when they enter. However, there is some changes within this, and part of this change within this has to deal with changes of exogenous factors and level of adiposity, something that we looked at when we talked about the dieting issues. Now, in terms of the Tanner stage development, there's not going to be as much in terms of the genital change that we'll see with males. However, we will see a little bit of changes within the changes around the labias for the female. We will also start seeing changes within the hair distribution on the anterior side of the pubis. This hair distribution will start with, just like with the males, being excessively sparse. And then it will start to continually spread and become darker, as well as more coarse. Most of the change in pubal hair for both males and females is going to be around the necessity to control friction during reproductive responses. Now, in terms of breast development, which is what is usually one of the two signs that are tracked in terms of Tanner stage development, we start with what's referred to as breast budding. Breast budding is going to be where we start seeing hypertrophication of the lobes without lobular rearrangement within the mammary glands. This is going to lead to a protrusion around the areola and the papilla of the nipple. This is asymmetrical in terms of change. This asymmetrical change continues through stage 2 and into stage 3, where we start seeing enlargement of the lobes with slight rearrangement of the lobes around the lactaceous sinuses. Most of this change is due to pulling and tensioning on the suspensory ligaments within the mammary glands themselves. As we go from 3 to 4, we get what's referred to as secondary mound development. And secondary mound development is where the lobes themselves start to undergo hyperplasia, producing more glandular tissues within the mammary gland itself. We will start seeing retraction of the papilla of the nipple into the areola at this point in time. This will continue to lead to rearrangement in between stages 4 and 5. For the female, as we move from stage 4 to 5, we will start seeing an increased ability to have a viable reproductive event, meaning that pregnancy can take place in stages 4 into stage 5, whereas for the males, it's very hard to have a successful reproductive event in stages 4 until you reach to stage 5. So one of the things that has been coming up a lot in the mass media is that there's been a change in puberty. The problem is that there hasn't really been that big of a change in puberty. With males, there has been an increase of sex hormone binding globulins with a decrease of free testosterone that has led to a delay in puberty and elongation of the maturation process. For females, there's been a slight pre-expression of estradiol due to increased adiposity. And so for both males and females, we've noticed a slight shift in the time frame for puberty. However, there hasn't been a change in when puberty actually starts. And most of the change that we see is the change in which we're increasing the rate at which aromatase is converting any of the androgens into estrogen and estradiol. However, the problem for females is that we're noticing fat depositing and indicating fat depositing as the change towards puberty, even though it's not really a change towards puberty, in which we get what's referred to as pseudo breast budding. And that has to do with adipose depositing around the mammary glands without actual maturation with the mammary glands. Whereas for males, the increasing of sex hormone binding globulins due to increased adipose and adiposity changes the amount of testosterone available, which means that even though we're starting puberty at the same time, it's taking a much longer duration in order to exit puberty for the male. Now, regardless of what has been talked about within the puberty, uh, there's little evidence to support that environmental toxins have a change in estradiol or in testosterone production to change the onset of puberty or the length of maturation. This goes to a lot of the BPA discussions that go on in the mass media. Now, there is indication that BPA and other endocrine disrupting chemicals do impact reproductive health in both cancer issues as well as fertility issues stemming from the endocrine disrupting chemicals, especially the estradiol-like endocrine disrupting chemicals, but there's no evidence to indicate that it actually changes the onset of puberty. The few studies that have indicated this were done in rodents where they were directly infusing BPA into the circulation and not giving it to them the way in which it would normally have been consumed. Now, that's not saying that BPA is safe. However, it doesn't actually change what we look at in terms of onsets for puberty. Now, the other thing that's been indicated is that the increase of adiposity has changed when we start seeing puberty, and the increase of environmental toxins has changed when we see puberty. There has been a downward trend across populations for when reproductive maturation takes place. And that's not just for humans, that's for all organisms that undergo a dimorphic change. This downward trend has no distinct linkage to anything within the environment outside of the environment being warmer and there being more food available. The warmer environment and the more food available is an indication of increased competition for reproduction. And that is one of the reasons why we see this downward trend. But what we have to remember is that with the increase in over fat population, there is no evidence pointing to a change in which the puberty is going to start. However, there is the indication for when we start seeing physiological adaptations within puberty, which means that puberty will take a much longer time to undergo full maturation because of the competing factors that adipokines have on pubertal signals and reproductive regulation for both males and females. And so one of the things you have to remember when we're looking at a lot of the data and when you're talking to future clients and or patients about the changing onset of puberty is that even though we may have reports of younger individuals experiencing puberty, in terms of normal populations, it's not that abnormal to have these early age onsets.